Thank you so much for coming. We are so happy to have you here.
Thank you so much, Udoka, for actually giving us the opportunity to share some information regarding COVID-19, chronic condition, and nutrition with the amazing student at Nevada State University.
Awesome. Well, we're happy to have you here always. I'm going to go ahead and share your screen. All right. I think I need to unmute Dr. Headley. Sorry.
I got it. I do that all the time. I'll be talking and need to mute, but I'm unmute. But again, thank you for inviting us to have this discussion with all of you. We really appreciate it. Just a little intro, Dr. Omelu and myself, we are the co-founders of Public, and we became very passionate about what we do, promoting healthy discussion, healthy people, and healthy communities. And we sat down and it was just a random discussion, and we're like, yeah, let's do it. Let's, move forward into the social change. That's our whole purpose of being here. So our Public mission, we are a platform for open and evidence-based discussions on public health issues affecting local and global communities. It is a platform that provides substantiated information and practical approaches to address our public health issues. Our vision is that we want to, again, raise awareness on local and global public health issues to promote healthy quality of life and environment to mitigate social and public health injustices. Next slide, please. So today, we're gonna highlight, we bundled one of our topics of discussion into one, but we're gonna reiterate, because I know everyone has heard a lot about the COVID-19, background on COVID-19. So we're just gonna briefly go over that. Again, the importance of making healthy decisions during COVID-19, the pandemic, to include nutrition and immune systems, and talk about having a healthy psyche as well. Next slide. So just some background of the COVID-19 pandemic and transmission. It is the novel coronavirus disease 2019. That's what the 19 is for. It was first identified in December 2019 in Wuhan, China. COVID-19 is caused by severe acute respiratory syndrome, coronavirus 2, and some of the symptoms may appear within 2 to 14 days after exposure or infection. And Dr. Omelu will get into, the fact that some symptoms do not show for some people in a couple of slides, but the virus can also be transmitted via airborne or droplets.
Yeah, thank you, Dr. Headley. By the way, I have to mention, I can't hold it. When you looked at our Public t-shirt that we have, it was actually Dr. Headley's son. So she's the first model for Public. So I give him.
He doesn't know that I included
doing
him.
This. So we really appreciated his support to support our efforts. So.
I was trying to keep it down so he didn't hear me, because he doesn't know I put his picture in here. Thanks.
So, by the way, moving forward with COVID-19 background, so this list of symptoms you see here are not definite symptoms. When COVID-19 started, it was about a short list, about maybe 3 or 4 symptoms. And as we progress into understanding this novel virus and the disease it caused, a lot of scientists started noticing different symptoms that other people had reported, and doctors started documenting it. Of course, CDC continuously update their guidelines regarding this condition. So now we have about fever or chills as one of the common symptoms, cough, shortness of breath, which is difficult breathing, then fatigue, muscle ache, headache. They have also reported loss of taste or smell, sore throat, congestion, or runny nose, nausea or vomiting, diarrhea was also reported in most of the cases. However, when you look at this, there's people that are considered asymptomatic that will not show these symptoms, but they are carriers of this virus, and they will still actively transmit the virus to somebody else. So, that has been reported, and we know that to be true. So I think, next slide, please. So now, if we look at COVID-19, we also notice that on the global level, we know the cases, which is the prevalence of new cases as well. And we also notice that on global level, there's a lot of death cases. And then we assess as well among those that are infected with the virus, how many recovered. So if you're looking at a global perspective, there's over 61 million people currently affected right now. Again, these numbers will change or continue to change. In terms of global death cases, it's about 186 per million, or 19 per 100,000. And the current global recovery percentage is about roughly 69%. Now, when we look at the US cases, it's over 13 million as of today. Again, it will continue to change depending on how we address this to flatten the curve. The death cases is actually in the United States is higher than the global prevalence, which is 816 per million. And then when you look at the recovery percentage, it's roughly within 59%. Now, I'm in California. When I looked at the California, by the way, I used to, when COVID-19 started, I did a lot of work in California for about 3 months straight. I did a 12-hour shift on the weekends, and I was working with the California COVID-19 team to help people in terms of providing them information about location for testing, and also helping hospitals in terms of PPE. But if we look at California, we now at over 1 million that have COVID-19. In the terms of death cases, it's about approximately 480 per 1 million. And for those that have recovered in California, it's roughly 47%. Now, I'm in Sacramento County. If you look at Sacramento County has about 37,000 people, over 37,000 people that had coronavirus. And Sacramento actually is the 8th in terms of the highest cases among counties in California. Actually, LA is the number 1. LA has over 400,000 people with COVID-19 cases, and about 7,000 death cases. And so when it comes to death cases in California, in Sacramento, there's about over 500 death cases, which now brought Sacramento into the 6th place in California. Now, why is all this information important? We're gonna discuss that, how all this information we're providing to you now links to nutrition and other chronic conditions. I believe Dr. Haley can go further and provide brief cases in DC area, because Dr. Haley is from DC area.
So I live in what they call the DC metropolitan area, which covers Washington, DC, Maryland, and Northern Virginia. And I actually live in Northern Virginia, so I stayed focused on my state. But for Virginia, as of, I try to get the numbers as close to time of this presentation as I could, but just to let you know, I'll tell you the different, the increases. As of 4:00 p.m. yesterday, the total cases for Virginia was 236,000. It's now, as of 8:52 p.m., at 238,000 for the state of Virginia. I live in a county called Fairfax, so I narrowed it down to my county since I do everything in my county. It's good to know these things. And when I pulled the data yesterday, we were at total cases of approximately 31,126, and we're now at 31,388. So you can see how it's going up. But out of that, the amount that are actually confirmed, we have 28,825 confirmed, and probable 2,563. So then they break it down to who's been hospitalized and deceased, which probably be more of interest to you, which is 638. Now, you know, we all see these different numbers that come out from the CDC and whatever different apps we may have, but we also need to note that the numbers presented are probably below or underestimates of what is actually true of the burden of COVID, only because there are certain factors. So, you know, I'm not saying that they're completely off, but, you know, the numbers could be higher. For example, someone gets tested, it takes a few days before the results come back, right? To know if they have it or not. Not everyone, like Dr. O'Malley says, has symptoms, so they don't even know that they're carriers of the disease, right? There are other things where, you know, not everyone seeks care from healthcare provider. They're self-diagnosing themselves. Okay, so they're saying they have COVID, speculating, you know, they might not, you know, who knows. And so there's just other factors, but I'm just saying overall that when we look at the burden of COVID-19 within our communities, we need to just interpret with caution. Thank you.
Next slide.
Oh, that's me. So, you know, I was in my zone here. I'm like, oh, I have a break. But anyway, healthy lifestyle choices during COVID-19 crisis. We're going to talk about nutrition and immune system. So we want to make sure to have a healthy diet and engage in physical activity. Both of those things in tandem will improve your immune system. For example, you know, physical activity can help flush your bacteria out of the lungs and airways. I'm sure a lot of you guys already know this, or can probably educate me a little bit more in this. You know, by, you know, ridding your body of those bacteria in your lungs and airways, you know, it can help prevent you getting the cold and the flu and so forth, any other illnesses. And, you know, your white blood cells are the body's immune system. So you want to be able to change those, and the exercise causes a change in the antibodies in your white blood cells. So you want to be able to fight the disease. So overall, healthy diet, physical activity will help improve your immune system. And Dr. O'Malley, do you have anything to add to that?
Yes, just before I go to the next slide and discuss the literature that we added in here, actually agreed with all the information that Dr. Haley just provided. You know, why is actually diet, physical activity, improvement of immune system very important? let's think about, or let's go back to when the COVID-19 virus started. Most things that, if including CDC, was saying that the most vulnerable, and this is true, the most vulnerable population is people with pre-existing conditions such as hypertension, diabetes, people that are obese, people with respiratory problem, and then in addition to that, older people, I think between ages of 65 and over, right? So this was the more kind of like underground, guideline to help people know who are at most risk. Now, if you look at, take for obesity, for example, most of the issues with obesity, and we know that small percentage genetics, right? But majority of the issue with obesity and even diabetes is nutrition, right? So now when people are not conscious about what they put in their body, now they expose themselves to the risk of other chronic conditions. And now when something like this, like COVID-19 is a good example, comes in, which is not a chronic condition, it's just an infectious disease, right? You see how the combination between a chronic condition aligns or combined with an infectious disease and produce a different adverse effect on people that are already in that condition, which was predetermined by the type of nutrition and lifestyle. Now, even with people that smoke, we also know that CDC was also reporting that people that are heavy smokers are at higher risk. So now when you look at the cases and when you look at the recovery and when you look at the people that die due to lower immunity to fight this disease, those, when you stratify those by lifestyle and nutrition, you're going to see that it will skew to those that are, having these risk factors, which we just mentioned, like smoking and lack of physical activity. So those are really, really important. That's why I like combining this topic with nutrition, chronic condition, and COVID-19. I'm glad that you guys are in nutrition field. So hopefully you guys will be the future for public health in coming years to continue to educate people the importance of nutrition. There are so many benefits of having a healthy nutrition, regardless of your age, because when you look at people at older age and say that they are at the highest risk, right? You also look at cumulative effect of what people have done when they were younger. And as they get older, how it also diminishes their immune system. You can see a 65-year-old fit and they can be able to fight this virus, So let's pay attention to that. Next slide, please. So now, just because we talked about this a lot, to provide some more information, what we call evidence-based information, we decided to present some few literature here. So let's look at, for example, Oshiga et al. 2020, right? So Oshiga et al. 2020, this is a data from National Center for Health Statistics, right? So they did this analysis. Let me summarize their key finding. There's a survey that they did that covers 2017-2018, right? And these are their key findings. They indicated that the prevalence of age-adjusted hypertension was 45%, and which is among adults, and was higher among men, which is 51%, than women, 39 or 40%, 39.7. Now, why is men higher than women? This is where academic institution comes in, because when they conduct this survey, they don't go in detail for what we call causal effect, why gender variation occurred. But when you find gender variation, then academics can come in and go further to identify some of the factors that are linked to these variations. Another thing they found is that the hypertension increased with age, 22%, 18 to 39 years old, compared to 55%, 40 to 59 years old, and compared to 75% for people 60 and over. Again, hypertension is not an infectious disease. It's a chronic condition. It's not even a disease. Actually, hypertension is not a disease. Cardiovascular disease is a disease, but hypertension, those are just conditions, right? And it also means that you can revert hypertension. You can change the cause of that, just like you can do diabetes and prediabetes. It can be changed, especially type 2 diabetes, right? So, for example, if there's high population within the United States that have hypertension, now when COVID happens, those people again are the people that might not make it, and if they do make it, they usually stay longer in the hospital, and their recovery time is longer. They also, the same study indicated that hypertension prevalence was higher among non-Hispanic Black. Again, this is where racial component comes in, which is at 57%, than non-Hispanic White, which is about 44%, or Hispanic, which is about 43%. They also discovered that hypertension was lowest among college graduates. That's a good job. Now, this is taking us to maybe educational factors. College graduate compared with those having a high school education or less, and those with more than high school or some college, okay? And the final thing they also identified from this survey is that overall hypertension prevalence decreased from 47% in 1999 to 2000. This is in the United States. It decreased from 47% to 41.7%. 41.7% was in 2013 to 2014. But then it increased to 45% in 2017 to 2018. So we did very well from 1999 to 2013 to 14. And then here we go, we started going back up again. So again, do we pay attention to what we eat? So that's where, again, nutrition comes in. And now, if we look at Carr et al., they also did a study regarding farming for life, where they actually promoting impact of medical prescription for fresh vegetable. What that means is that now the doctors are starting to understand the importance of helping their patients. Instead of just prescribing drugs, they are actually prescribing fresh vegetables. So now it's easier for a patient to say, hey, my doctor told me to have fresh vegetable. And the adherence for them to do that is more readily done than if they did it on their own. So in their study, they concluded that medical prescription for fresh vegetables was associated with clinical relevant improvement in cardiovascular risk factors and quality of the variables. So they actually show that it helps, right? And it helps to reduce all these risk factors. And now if we go to Trapo et al. As well, again, all these are all about nutrition. They also did a study where they also showed that showed the dietary impacts of produce prescription for patients with hypertension. So in their finding, they indicated that participants that were prescribed produce visited at least one farmer's market. So if your doctor tells you this is necessary, that they are more or less more likely to start going to farmer's market to buy fresh produce. And then for the bulky etal, again, it's all about fruits and vegetable consumption and the incidence of hypertension. So they did that study, and their conclusion is that they showed that results suggest that greater long-term intake and increased consumption of whole fruits may reduce the risk of developing hypertension. Again, this is this is a Harvard School of Public Health that did this study, and they found this. And the final article here actually was done in my branch. It's one of the program I actually manage in California. It's called Wise Women. Wise Women is a program sponsored by CDC. And CDC, the goal is to identify women ages 40 to 64 years old and see among these women if they have hypertension, diabetes, or if they have cardiovascular disease. The goal is to provide health coaching to them to change their diet to healthy diet, and then or refer them to lifestyle change program to lose weight, in addition to taking their required prescription. So now the doctors are realizing that just giving people prescription is not enough to address this pandemic, which is chronic condition, hypertension, cardiovascular disease, obesity that we see. So in this study they did, actually they published this article before I joined this organization. They also was reiterating on the need to have a comprehensive approach, including diet, in fighting chronic conditions. So that's where we come in as, discussing how diet is linked to chronic condition and also its impact in current pandemic.
Yes, I do like how you displayed the different the years from 2009 to 2020. So you're showing that there are continual studies being done in nutrition and different diseases that people acquire. Just to give a real life example, I can attest to medical prescriptions for with fresh vegetables. My grandmother was diabetic for a long time, and she changed her diet. Suddenly, the medication she was on was making her ill. She made a few phone calls, went in, they ran several tests because they couldn't believe it. She reversed diabetes. So based on her smart nutritional choices, and she's been diabetic free since, and she's 92 years old, and you would never know. So it can be done. It can be done at different ages. You don't have to be young. It has no age. You just have to make healthy choices. So thank you for that. Moving along on maintaining a healthy psyche. I'm really big on that because during this pandemic, some of us internalize our stress, and some of us, people are having breakdowns. I'm seeing it every day. But just to go over a couple of studies that I found to support that stressful environmental conditions is associated to increased mental health issues. One study that I found was on, let me see, I have a couple, maybe too many, how public health emergencies affect the health and safety and well-being of both individuals and communities. So it was causing insecurities and confusion. We are now going through emotional isolation and stigma. We're at a time right now, especially during the holidays, we can't be with our loved ones, I'm a big throw parties for family person. Can't do that. Birthdays, I'm a big birthday person too. Can't go celebrate birthdays and do surprises and all the stuff that I would like to do. I have kids, and my oldest son had a meltdown, why can't I, do this and that, we didn't get to go anywhere, he really broke down and cried. So there is a lot of emotional stress at all levels, at all ages. And, the only thing I could do for him is, try to create an environment in the home that is, gives them some relief and fun, the best that we can. Let them run outside, but, they're not playing with their friends like they used to and stuff like that. But also our community has been impacted. We know there's been economic losses, schools and work, they're closing, people are losing their jobs. That's an additional stress, right, on a person. People are picking up unhealthy behaviors. Okay, what do they say? A lot of people are excessively drinking now. Stuff like that. Every time I turn around, someone wants to do wine time on virtual, and I'm like, why? So, these are things that we would not normally do, on a given day when we have to drive into work and things like that. Also, a 2020 study suggested that disaster mental health had emotional distress within populations affected in a pandemic crisis. And they're finding it might be relevant to understand the possible long-term impacts of COVID-19 pandemic crisis. It was looking at also the challenges of healthcare workers. Dr. O'Malley will tell you, she has a lot of personal stories. My husband is an essential worker. I deal with all of it, call me, I'll tell you a story, a true one. But my husband's an essential worker, and it's really funny because, he has this straight face, you don't know his emotions, but he developed a sense of anxiety. I guess he internalized it, and then he just went through this whole, it was just a weird spiral of, I'm going to go get tested. I was dealing with the patient who had COVID. I was like, weren't you masked up and protected? He said, yes. And I'm like, I don't get it. The stress of little ones wanting to run and hug daddy, right away. You can't do that anymore. You have to go take care of yourself if you're dealing in that public arena. And then you can, the wait period, it's just a lot of emotional stress that takes a toll on people during this time. And if you want the literature, I can gladly add it to Dr. O'Malley's list. I know he wanted to share those for everyone to review on their own, and you might have other you might acquire other literature as a result of reading the ones that we're presenting today.
And I will post these on our club site for anyone who wants to see those.
Okay, thank you.
Yes, so adding to Dr. Headley's stress experiences. Now let's talk about how do we effectively manage the stress and cope, because sometimes, it's beyond our reach to be able to actually manage anything, and we just need to have to cope with the situation. How do we do that? So what we did was we decided to actually that would be in the next slide, please. So we decided to put short list of what we think that can help anybody going through this, And imagine like the story Dr. Headley just shared about her husband, right? a health worker working, their goal and their intent is to treat and make somebody better. But a COVID-19 that we do not have any treatment for, no vaccine, nothing, and somebody with good intent wanted to treat, and what they worry, especially if they have family and if they have kids, even if they don't have their own direct family, but they have relatives, what they usually will worry about is like, is it possible that I can take this from the hospital and give it to my loved ones, and that the possibility of me getting this from hospital and actually giving it to my loved ones and actually having my loved one die because it came through me. That stress is something that will actually haunt you for the rest of your life, right? So now, how do we cope as human beings? We think healthy eating is very, very important. If you're not already, have a lifestyle where you want to continuously eat fresh fruits, specifically if you can afford organic produce, that's even much better, right? Because what it does, it will improve your immune system, right? We urge you, nutrition students, to always participate. Find a way to participate in physical activity. It's very good. Dr. Haley already touched on this, how it helps improve your immune system and detox you, right? Again, another thing in the list is do not be overwhelmed. Under this pandemic period, do not be overwhelmed with paranoia. It's easy. Actually, it's easy to say now, but in actuality, it's hard. But, let's try our best not to be paranoid, right? Relaxation is important. Why is relaxation important? It's important for one major thing: avoiding or limiting stress. Now, somebody will ask, why is stress a big problem? Then stress is a big problem, even in chronic condition. When people are stressed, and in fact, when people are in acute stress and cumulative stress, what it does, this has been done in scientific literature. It has been extensively researched, and we know what stress does. It produces a chemical called cortisol, right? And when you have a lot of cortisol in your system, it's not good. There's nothing good about cortisol. Well, maybe, in a little quantity, but if you have a lot of cortisol in your system, it actually hampers with your immune system. Your immune system will not be working the way it should be working. Imagine that now you're stressed out about COVID-19, and then you have all this amount of cortisol going through all your body, and here you go, you get COVID-19. Now, additional stress comes in because you get COVID-19. How would your body fight it? So that's why it's important to have enough rest. Avoid information overload. Get the basic information about COVID-19, get the basic information about how to protect yourself, but don't go fishing with so many other information. I mean, it's good to fish, but control your emotion, control the information you take in, ask questions about the information. Don't just take anything and run with it. Do your own research and, be safe with a lot of information overload. Enjoy a safe hobby. The reason we put safe in there, if you like going to party, right? Ask yourself, is it at this moment in time safe for me to go in a crowd and expose myself? If the answer, common sense answer says no, then that's not safe hobby. So protect yourself. That's the best thing. And then as we actually wanted to add reading, because you know why we did that? Because you guys are students. So I think reading is important. I know a lot of you guys are already loaded with homeworks or whatever. But if you have you know, something that will not stress you, not chemistry, not, you know, other stuff that you stress about. Just read something, you know, that will relax you. A novel, something very fun, you know, it will increase your immune system as well. And there's one thing that Dr. Headley did. It was actually a smart thing. Like right when COVID-19 started, I'll be talking to Dr. Headley. I'm like, what are you doing? She like, hey, I formed this group. I'm like, what group did you form? She went ahead in the beginning of COVID-19, as smart as she is, went and formed this group, online group. They meet online. They cook, you know, they do a lot of experiment on cooking healthy food online through Zoom. And she just spearheaded that stuff. And then another thing she added to that was, I don't know the term she coined it, but
chat walk.
Chat walk,
the
exactly.
Chat walk.
She had a chat walk group. What does it mean? They're all gonna sit in the Zoom and start walking, and you know, like we're having this discussion, and they're all walking, all with their phone on the Zoom. So again, and the thing she shared with me one of the time is that some people will be walking, they don't even know why they're chatting. They already have, you know, walked 10 miles or 5 miles. And, you know, it's another approach for you to actually engage yourself when you're confined in an environment that doesn't allow you to have an in-person interaction. So that's smart of you. And Dr. Haley can go further and discuss her chat work.
You covered it, but also what's funny is we have on. I had to laugh as you were going through the list because I start, you know, my brain starts turning sometimes. But avoid information overload and do not be overwhelmed with paranoia. It goes hand in hand. You know, I always tell Dr. Omalu, we have to debunk the false information. That is our job. I get so upset when I see all this information, all these YouTubes or whatever, people saying, you know, these different things about COVID, or we have a cure, you know, you just make your own concoction and drink it, whatever the case may be, right? You don't need a vaccine. All these things, I get so, you know, he gets a phone call from me when I'm like, did you see that? But, so avoid information overload, also be smart about what you're reading, because, you know, your other friends of yours might be paranoid. So sometimes you have to play that mediator between the fake news and what's reality for them too, to calm them down. So you might find yourselves in positions where you are their mentor at times to say, hey, this is not true. These are the facts, you know, so, you know, be careful with that. Also with relaxation, there's a woman at my job. She does a Zoom on, you know, she picks different days of the week. She does 15 minutes meditation. Whoever wants to join, we join, and we do deep breathing, meditation. And, you know, she says you can bring your kids, they can join too. It's for everybody, your family, whoever wants to join, joins for 15 minutes of your work day. And it does something with the calming, for me personally, because right now with the virtual schooling, I'm the principal, I'm the janitor, I'm the cook, I'm the administrator, I'm all of it while working from home full time, as well as doing Public and my other stuff too. So like right now it's almost 10 o'clock p.m. and I am wide awake. I don't know why, but I am. I'm excited about this. So I tell Dr. Omalu he doesn't sleep, but I guess I don't either, because I always respond at you guys' time. I'm always here and responding. So I guess, you know, it's the pot calling the kettle black. But thank you for the list and going through that. So next slide. In summary, we just want to reiterate, currently they're really, with everything that we said, there's no specific clinical guidance for nutrition care and COVID recovery. We can only, tell you things that make sense that we know, and based on different studies that have proven so, but there's no guidance out there to say, eat these things or whatever. Everyone's body's different, different foods for different people, and nutrition styles. Healthy nutrition and physical activity and hydration are essential in improving your body immune system. So remember, stay hydrated. Some people say, you drink a lot of water. I've been doing that before COVID. I do drink a lot of water. I do, all day. But, and then you have people that say, I'm not thirsty, but your body's still dehydrating. Rather you feel thirsty or not, you're still dehydrating. And Dr. O'Miller will take the rest.
Yeah, so Dr. Haley already discussed that, our body is almost composed of water, 70%. And of course, that's why it's necessary for us to, replenish the fluid in our body. If you have COVID-19, there's not a space right there. I have COVID-19.
You would pick that out.
But so along with nutrition best practices, which we recommend, fruit and vegetable, fresh produce is very important. If you can afford organic produce, please invest in organic produce. I'm saying this using this term because I had worked in biotech company for so long, and I know the difference between organic and non-organic produce. Health-wise, it's better to stay with organic produce. We must also maintain a good mental health by engaging in activities that reduces stress, that we discuss about how stress increases cortisol in the system and lowers your immune system, which makes you more vulnerable to not doing well if you get infection. All this should be something we should do as we cope with the COVID-19 related hardships. So that's where we're gonna leave this, and the next slide contains our information. This is our email, thepopaholic@gmail.com. Here is our website, popaholic.org. You already know what we do in Popaholic, and we have Instagram. This is the link for our Instagram, Facebook, Twitter. We recommend that you should visit our website. We have a registration in our website. It's free. You can register in our website. We will be producing some T-shirts and some accessories. So, you might want to get your hand on those stuff.
So we encourage you overall to continue healthy discussions like this. We want you to continue to do what you can to remain healthy people, especially during this time. And we encourage you to influence your communities to adopt healthy environment practices. And we truly thank you for having us and really appreciate it. I had fun, and I hope you guys took away something positive from that we added some value to your evening. And now we're opening up, I guess, for questions and answers.
Yes. So I saw a few questions in the chat.
Yes, I'm looking now.
Awesome. So we have this from Reese. Reese wanted to ask, with the stresses of school combined with COVID-19 stressors, how would you guys suggest students adapt or overcome information overload or being overwhelmed?
That is a good question because, we can't all be together. My mind always says, form a group, blah, blah, blah. No, you can't really do that. School is very stressful in itself. Trying to maintain your grades, and then you have other environmental influences that prevent you from that you have to engage in. Some people have, you have families, we understand that. There's a lot of different factors. But to overcome information overload, honestly, sometimes, and this might not be the answer you're looking for, but I just shut off all media and decompress. Like sometimes you just have to do that. Period. I do that weekly. Dr. O'Malley will be like, did you see? No, I did not. I shut off social media. I shut off my TV, everything. That might not be for everybody, but also, I just, find something that else that I like to do. I play Scrabble online. You might see me online. My husband says that Scrabble has taken over. I'm like, no, it's fun. It's actually fun. So I do play Scrabble online times of the night, and stuff like that. I just find, I know people that they've embraced solitaire. We do more family games. I'm actually beating my husband in chess now. I'm proving to him that I am awesome. Showing off my chess skills. So if you're not home alone, then it's easier to decompress if you get creative and think of other things to do. Picking up, like Dr. O'Malley says, hobbies. For some strange reason, I enjoy doing paint by number. We did that virtually, me and my family. Everyone ordered paint by number, whatever you want, and we just paint and talk. We've gotten really creative, but take COVID-19 out of it. School is important. Your ultimate goal is to be successful in school. Don't let COVID-19 stress you out. If you're quarantined anyway, you're home, you are doing the things that you should do, you're wearing your mask, you're not putting yourselves in positions to be out and about unnecessarily, then I think that stress could be you can overcome that stress. My neighbor, she goes hiking. Not many people are hiking, right? So she carries her mask and she goes on the weekend, she goes and be one with nature, and she does yoga and meditation and takes beautiful pictures by the waterfalls. Although Northern Virginia is quite cold, I'm sure you guys are enjoying the warmer weather.
But it snowed a week ago, I think, in Reno. So we're getting there. We're getting there.
Okay. So, you just have to find your happy spot, I think, is the most important thing. But let's just remove COVID out of this and, focus on things you love to do,
I totally agree with what Dr. Haley just said. All this stuff is more like a psyche thing, right? If you can psych yourself out and say, okay, we as human beings can cope with any situation from our evolution. We will cope. At some point you have to demystify some of the information and take certain things away from it. Consider, for example, there was a time there's no Facebook. There's no, I know you guys are new generation. There's no Instagram and all this stuff. Guess what? Human beings still cope, right? So you need to just find a sweet spot, like she said, and, think about things that are relevant to you, and then do that.
Email me at Pubholic. I can come up with some things for you. Get stuck, email me. We'll talk.
Right. Yeah. So, I agree totally.
Awesome. We do have another question from Jacob. If you were to be selected to be part of President-elect Joe Biden's COVID-19 task force, what are the first steps or mandates you would implement nationwide? And just to interrupt, your email is thepubholic@gmail.com, correct?
Yes.
So, I'm going to type that in the chat.
Okay. I'll be looking for it.
Well, what I would do is,
Read,
first of
right?
all, I would just start doing a groundwork to see why the cases in the United States is increasing. Because I can also look at other countries and see what they've done. Why is their cases low? And why is our case high? You know, it's not good to jump into a lot of stuff and start panicking about all the cases. Maybe there's something else other countries are doing and they're doing it better. Their cases are low that we can actually do right away and lower our case, since the time for vaccine to come actually takes longer for if you actually want to do safety and efficacy very well. It takes about 6 years to get a good vaccine or a good drug out. So there's no need to rush on a lot of medication, because when you do that, when you actually rush, we are going to go back to what happened in the 80s with HIV, right? You know, the first drug that came out was AZT for HIV. Guess what AZT did? AZT at the time was the shortest drug that the shortest approval, the shortest drug that was approved by FDA. You know, it was approved very, very fast. And down the line later on, they started doing analysis about the drug, and they found that the drug was actually not good at all for HIV. It was actually accelerating HIV into AIDS. So we do not want to make the same mistake again. You know, we need to be cautious. We know we don't have cure for this. We know that. But what are the things other countries have done effectively to lower the curve? We should learn from other countries, and we should, I know it might not work for the US because US has a different cultural integrity, right? But we should learn what works and see how we can tailor it to the United States and make sure that we flatten the curve.
All right, thank you. Does anyone else have any more questions they would like to ask or add or just conversate? Oh, I got another one. With the amount of false positive COVID tests being recorded due to people contracting the flu rather than COVID, how do you think health officials could better distinguish the difference so that officials will not resort to calling it COVID?
What was the last thing you said?
How do you think health officials could better distinguish the difference so that officials will not resort to diagnosing it as COVID-19?
Yeah, again, that deals with the sensitivity of the test. Just like how I just briefly talked about getting vaccine out, right? Yeah, we don't know, first of all, if we rush vaccine to come out and we don't know anything about the efficacy and safety, right? It might help reduce something, but we don't know the long-term effect because we rushed it. Just like AZT, I'm not making this up. This is in history. Anybody can check out AZT, what it did with HIV patients, right? So the question you just read is relating to sensitivity. If we increase the sensitivity of a COVID test, it will be good enough. Or if we have multiple tests for COVID tests, right? You know, we can use one to test and use one to confirm, right? It will reduce the misclassification bias in test results.
Awesome. Thank you. All right. Anyone have any more questions or anything they want to add? All right, you're getting a bunch of thank yous in the chat. Awesome.
Thank you, guys.
We thank you guys. We appreciate it.
Awesome.
Don't forget, Popaholic is for healthy discussion, healthy people, and healthy environment.
Thank you. Awesome. I will definitely link that website on our page if anyone wants to go and look at any of their podcasts or t-shirts, merch. Thank you so much, Dr. Omelu and Dr. Headley, for joining us today. We really appreciate it.
Thank you so much, Udoka. We really appreciate all your help. Thank you, everyone. Bye.
Thank you. Bye.
Good night, everyone.
Good night.